Hi everyone, this is Ting with Xinhua News Agency. Welcome to our live program with 3 Xinhua social media platforms, Facebook, Twitter, and YouTube, here in the city of Shanghai. Gastroscopy is considered to be one of the most direct and most important ways to check gastric diseases. But traditional gastroscopy requires intubation, which makes patients feel physically unbearable and physiologically formidable. The capsule robot is now on my hand. The shape looks exactly like the capsule we eat, a little bigger with the size of only 27 millimeters in hands and a diameter of 11.8 millimeter. Guess the weight of it? Less than 5 grams. But it has more than 300 position components in its tiny body, which integrates a series of magnetic control technology. The doctor now is moving the robot through the counter. We can see that the little capsule robot is dancing towards doctor's control on the operation table. The doctor controls the left and right levels on the operating table, which can flip vertically and horizontally, and move back and forth. Through this series of fusion, the doctors can guarantee that the capsule can be observed in the body of the human stomach with a 360-degree angle. Okay, the guest beside me is the co-founder of the Uncom Medical Technology, Dr. Wang. Hi.
Hi, nice to meet you.
Okay, nice to meet you too. Okay, so we can see now the patient is taking the jacket on, right?
Yeah.
What's the jacket for?
This jacket consists of a array of antenna to can receive all the signals transmitted from the inside the capsule endoscopy. So all this imaging was transferred from wirelessly. So all you need an antenna to receive all the signals, and this signal also function as a bridge to convert all this data from the capsule to the terminals. This terminal is more like a imaging we call workstation. So this provides all the interface to the doctor to do all the diagnostics.
And could you please introduce the significance of the magnetic control technology?
Compared with conventional endoscopy, the endoscopy always a very long tube and have to go through the human's mouth. But this, even though this is a very mature technology, it causes some uncomfortable, and also there are some potential risks for cross-infection. With this magnetic control, it completely remove this long tube. So it's a wireless technology and allow all this capsule endoscope can be controlled inside human body, more like a navigation. So we call the navigation capsule endoscope. That's we call the Navicam.
Okay, so could you please introduce what is the operator do now?
Okay, so the whole procedure is starting from first, the operator will open the package of the capsule. This is already manufactured in the non-bacterial environment. After that, he will give this one to the patient. The patient will swallow this one. Before he swallows this one, he will check with the patients with all this the normal procedure as a conventional endoscope. The only difference is this scope will be activated by optical means. So after the capsule is activated, you can see the pictures, and the operator will record some information related with this procedure.
Yes, we can see the picture
Yeah.
on the screen.
So he take a picture of the barcode to make sure this capsule was swallowed by the patient. So make sure all the data is consistent with the personal information. So the next step, after this recording, he will give this capsule to the patient. The patient will swallow it, and the procedure will starting. So compared with a conventional endoscope, this procedure is completely what we call the non-intrusive. Which is non-intrusive, the patient is completely avoid any complication for the conventional endoscope. So we'll see how easy for this procedure.
We can see the robot now is lightning.
Right. Inside human body, it's completely black. It's not outside. You can have a natural sunlight. And just like the regular camera, you need a flash. So this flash is a LED technology. It completely illuminates the human body. With this illumination, the sensor can detect all the images inside the human body.
Okay.
So
the operator can see the inside clearly.
Yeah, exactly. So right now is the first step. The patient will provide some water, just a small cup of water, which is a capsule. When he swallow, it's just like the normal capsule.
Will it be hard for the patient to swallow the capsule?
So if you have a chance to see the conventional endoscope, you will see at least the doctor or the operator need at least one nurse to help, to assist, because it's really not very comfortable, experience. And for right now, you can see actually the patient is lying there very like a crowd, and there's no any uncomfortable response. So the capsule right now already inside the patient's stomach. So you could see the imaging is transmitted smoothly.
What is this part for? Because it's moving.
This is actually the core technology of the whole equipment, and it provides a magnetic control. And inside the equipment, there's a huge, actually not very huge. It provides a device. It provides a magnetic field. This magnetic field will to generate some force to move the capsule inside the human body. You could see there's no any connection between this equipment and the human body. So this is completely wireless. It's not only the information it transmits outside wirelessly, but also the controllable, the whole functionality was done wirelessly.
So which part has the capsule robot get in?
Now you can see the imaging is moving, and this imaging is moving. It's more like something like the operator. The eye is extended through the wirelessly on the capsule. So now what we observe the stomach is from the capsule side. The capsule, just as the question you asked, was this flashing? The capsule use the LED to illuminate the inside body, and then it's very like a small robot inside the human body. It can see the different parts of the stomach. So you can see the picture is relatively very clear. It's very like when we hiking, we go through a very dark tunnel. Inside dark tunnel, you need open your flashlight, and you illuminate somewhere, and you try to explore. For this patient, you can see it's relatively it's clear. There's no any abnormal there, so it's a healthy stomach.
So we can see the patient. He was just moving. So why he is moving? To help the robot to see the stomach clearly?
This is the two step. The first step, when the capsule first jump in, we ask the patient to lie down this way, typically on the right side. This one will to help to avoid the capsule to stay in the stomach. And the next step, when the capsule try to diagnose the other part of the stomach, and we ask the patient to lie down, a flight. The whole procedure compared with the conventional one, it's only take like 10 to 15 minutes. So within these 15 minutes, the patient do not have any like a bad feeling. So he can stay there. So even listen to the music, talk to the operator, or even take a phone call. So it's a completely like what we call a non-intrusive and comfortable procedure.
This is quite different with the conventional one.
Exactly. The way is for all these diagnostic procedure, there are a couple of key factors: low risk, comfortable. So with a very low risk and very comfortable procedure, you can make sure there's more patients will like to take this procedure, so it will cover more patients.
And how long in advance for the fasting?
Typically, just it's pretty easy. Just the day before the procedure, in the evening, and also in the morning. So you should not eat any food. Just have some like water or fluid, but no color fluid allowed, because all this one will block the view of the operator.
Yes. So if we do the check in the afternoon, so how long it has to be in advance for the fasting?
It's still the same. Just do not have any like food in the previous evening, so no dinner, and
Okay, so just the whole day, just the whole day.
almost a whole day. So that's why most of this procedure is recommended also in the morning,
Yes,
not in the
yes,
afternoon,
yes.
right? So you see, like this patient, there are only like small pieces of the black. Those one is not the food, but most of the part is pretty clean. And with this magnetic the controlled capsule, it can move to avoid all these additional parts to cover the camera side.
How long the procedure usually takes? We can see about 5 minutes has been passed.
Right. Typically, it takes about 15 to 20 minutes, depending on the preparation of the patient's stomach. If it's very clean, like this one, its muscle part is clean, and it takes around like 10 to 15 minutes. If there's additional, like the preparation is not very good, and the operator may ask the patient to drink additional water. And also, this water will help to enlarge the stomach.
I'm wondering how is the patient feel like? Let me ask him.
Oh, okay.
问一下病。How do you feel like?
It's good. There's no pain. There's no discomfort.
Okay.
Yes.
Do you feel something moving in your stomach?
Yeah, when the ball is close to my body, I can feel it.
Oh,
yeah.
you can feel
Yeah,
it.
when it's far away from me, I can't feel it.
Okay, so when you lie down in different directions, so can you feel it?
Yeah, yeah, the same way. When the ball is close to my body, I can feel it. Yeah.
So are you worried about the radiation of the
No, 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 because this is the permanent magnet, so it's no radiation or something like that.
Okay, so the question I have to ask Dr. Wang. So many patients may worry about the radiation of the.
For all these imaging diagnostics medical equipment like MRI, like the CT, X-rays, all these one have a radiation, even though they control this one, but most of the patients are still worried about. The ultrasound and endoscopy is a different stuff. Like this one, capsule endoscope, they generate some magnetic, but this magnetic is first is a static magnetic. It's not like the high frequency one. This is the first one. The second, the intensity of magnetic field is much lower than the regular. Let me give you an example. For the MRI, Typically, the intensity is around like 1 Tesla to 3 Tesla. But this one is about 10 times lower. So it's just around 2,000 to 3,000 Gauss. So it's much lower than that.
And what's the material of the robot? Will it maybe probably broken in inside your body?
So that's a very good question. You know, most of the patients, when they first swallow, they have a concern. Is it safe? You know, from the design to manufacture, we have done a lot to guarantee this capsule. The material. The material is special material we call the PC. This one will not to generate any additional chemical like a poison stuff, and also the structure of the capsule was special designed, and it just like the egg. You know, when you try to broken the egg outside, this shape and the structure is very stable. The third one is for all these manufacturers, through the manufacture procedure, we have a very strict procedure to control and to test this one. So it's not like you sample, you test just pick up one like we call the sample test. We test all the capsule when we delivered to our customer.
And how to deal with the capsule after the procedure?
This is called a disposable device. Means it's one-time use. So the one-time use will provide the advantage to complete eliminate the cross infection. So after the procedure, it will disposable, just like the regular food. Yeah.
Okay. So about 10 minutes passed. So how is the process of the procedure?
So based on the procedure, they already standardized like which part they should observe first and then move one by one. So for this one is almost the end. So it's two-thirds of the diagnosis has been completed. So even here, he's very young and has very healthy food, but you can see here there's still a little bit the red stuff. Yeah, but that's not abnormal, but it can show just like a human's skin, they always have a little bit defect, but it's not a big deal here.
Okay. So the procedure is almost to the end?
Yeah, that's right. So after this procedure, the well-trained specialist, like what we call the operator here, will complete the first step of the whole procedure. They take all the pictures, and all the picture was stored in our what we call the workstation. And the next step, all this image data can be examined by the doctors locally, and also there are some other the new technologies, because all this imaging is what we call the digital imaging. So it could be uploaded to the cloud server, and even the doctor is not co-located with this machine, and for example, they are in Beijing or Shanghai, and in the other centers, they can also download from the cloud server and use their iPad or even their phone. If they have a big phone, have a big screen, they can they can review all these pictures and then send a report back to the center.
It is an inevitable trend. The addition of high-tech artificial intelligence products such as capsule robots is making doctors diagnose faster, more accurate, also make the patient more comfortable and more convenient. Okay, this is all our live program today in Shanghai, and I'm Ding Ting. Hope you like it. If your friends is interested, please share with them. See you next time.